A warm good evening, everyone. It's a great Sunday today. It's the fourth day of the International E-Conclave. Very interesting day because on the last 4 days we have been, since the last 3 days we have been speaking about a lot of things about pharmacotherapy related to tobacco cessation. So, because now we are moving towards the panel discussion. Our next chairperson for the evening is our very own Dr. Jagdish Kaur, who is a regional advisor of Tobacco Free Initiative from the WHO Regional Office for Southeast Asia. Dr. Jagdish is presently the regional advisor for Tobacco Free Initiative at World Health Organization Regional Office for Southeast Asia. She's medical doctor and public health expert, trained in global tobacco control from John Hopkins Bloomberg School of Public Health, USA. And she's also worked extensively with the Ministry of Health, the Government of India, where she spearheaded a lot of development projects and implementation of several national healthcare programs at the high and was also part of the various high-level committees of the government. She has published several research papers at the international and national level and has a lot of experience with NCD surveillance at different stakeholders. I invite ma'am to chair the panel discussion.
May I now request another long-time friend of mine, Dr. Jagdish Kaur from WHO SEARO office, to have your initial remarks. Dr. Jagdish, please.
Thank you so much, Professor Desai. I mean, it's so nice to be on this panel because there are so many friends, long-time friends and colleagues on this. We share a very long association. And good evening, everybody. So basically, this is a very important topic. And first of all, thanks to the organizers. And I must congratulate them, for bringing this in this way. And then finally culminating with this panel discussion, this topic. And WHO this year, as the World No Tobacco Day theme had commit to quit, I think since the time WHO has been having this World No Tobacco Days, this is the first time we have been focusing on cessation, which is a very important part of overall tobacco control and a very important, demand reduction strategy and very close to my heart. I've been telling them to have this as theme so that we can take it further. So you have done a good job that this theme, because it's a year-long theme and it is culminating in December this year. So we can have activities to reinforce this, and so that this I was just listening, and it is as per the GATS report that 50% of the tobacco users, they want to quit, and knowing that nicotine is highly addictive, we need to give them support to quit. So these are my initial remarks, Professor Desai. Let's move on to the panel.
Thanks so much. Thanks so much, Dr. Jagdish. Thank you.
Thank you so much, Professor Desai, again. And thanks to all the panelists. And we had wonderful ideas, wonderful remarks, and wonderful feedback from the discussions we had. Basically, we have various partners, various networks who are working in tobacco cessations, and ICanCaRe being one of them. And we have guidance. We have lots of guidance, lots of advocacy material, like now the digital innovative material also from WHO. We have lots of things, but we have to put everything in perspective to come out with the best solutions. So we cannot say that the counseling is best or NRT is best, like Pratima said. It's continuous. We have to have the motivated people, retain the people. We have to have combination of things. So, and like COVID, it was an opportunity for people to quit. But like she said, the calls had increased, but on the other end, we didn't have people to handle that. And government is now trying to integrate the cessation and quit line, but that had to be done on priority, so that people who are calling, their calls are not falling on like nobody is receiving them. So that should not be there, because nobody is going to call you again. So these are the little things, because the program was started, government started National Tobacco Control Program in 2007-8. We were the ones who started the first phase, then the second phase came, and now it's all over the country. But there is a lot to do yet, because cessation was a neglected part. Pratima has, they have been the kind of gurus of it, and yourself leading the TCC initiative beginning of the century. So there are, we have these people who have been the leaders in tobacco cessation, and and kind of, when I was looking after mental health and oral health and other things, try to integrate into all the programs which can be. And then the TB, now we have the joint framework also. So tobacco can be integrated with anything, and with a country which is the second largest consumer of tobacco, It is everybody's business. Tobacco cessation is everybody's business. Like now we are doing this NRT collaboration program donated from CIPLA with IDA. So they are doing with public and private sectors both. So I think everybody has to have this training because this is not in the curriculum, the addiction. So in the undergraduate medical curriculum, dental curriculum, pharmacy. So these trainings are, they are must. And then we have to ask each and everybody about tobacco use, record it, give the brief advice to begin with, and give whatever treatment is available. I think that these are my remarks. Thank you so much. Over to you, Dr.
Thank
Desai.
you so much. Thank you. I cannot but help recall very briefly how, in the first decade of this century, my friends, my longtime friend, Dr. Jagdish Kaur, working in the ministry, had my personal Airtel phone number on the website, and she would give providing, and people would keep calling up and say, "I've been given this number for tobacco." But yes, we have come some long way from there, like many of you said.